morning, my online viewers. Welcome back to my online teaching class. My name is Nurse Aijay, and for today we'll be discussing the dangers of self-medication. But before we go into this topic proper, let's take a look at what self-medication is. Self-medication means when you take a drug without prescription from the doctor or without undergoing the necessary prerequisites needed for a drug to be taken, which includes conducting a clinical investigation or carrying out medical tests and having the doctor review your results, coming up with a diagnosis, and then listing other lines of management for you, and then prescribing drug. So before a person self-medicates, he or she has already self-diagnosed. So this person says, based on what I am feeling, based on the symptoms I'm getting, I think this is what is wrong with me. And then this person goes further to go and procure a drug from the nearest medical store or a chemist. It is very important to note that in sane countries or in developed countries, self-medication does not happen, because before you buy a drug, you must present a doctor's prescription. So it is more regulated there than here. And self-medication poses a lot of damages to our body and should not be adhered to. A drug, as we know, is a chemical substance which is taken into the body through different routes. You have the intravenous, where you take it, it is injected through the vein; intramuscular, where it is injected through the muscle; orally, where it is taken into the mouth as a capsule or as a tablet; topically, where it's applied on the skin; suppositorily, through the anus, where a drug is inserted, mostly a drug that can dissolve through the vagina or through the rectum, and all of that, and other routes too. Then all these drugs is taken for the purpose of prevention, control, and treatment of disease conditions. Now, before a drug is taken or before a drug is produced, it has already passed through some screenings, and it has been assumed that it is healthy for human consumption. And the same body that is responsible for production of drug and dispensing of drug can still come up and say this drug we've seen that this drug is no longer healthy for human consumption, please let it be banned. And some people that don't even know, most people that sell drugs still go to the market and buy this kind of drugs. So when you are self-medicating, number one thing is that you might be taking the wrong thing. You might be taking a drug that has been banned. And because people go to the people that sell drugs, some though go to the drug and see that it is still very cheap and people are still in demand of this drug, they still buy it and sell out, and it becomes a problem to you that is taking it. And the number two thing is that when you self-medicate, you might be wrong at your diagnosis, or let's take for example, you are even right at your diagnosis. What about you taking the wrong dosage? Maybe you are underdosing, you are taking what is not up to what you should take, or you are overdosing. As we know, overdose can cause a lot of reactions such as anaphylactic shock, where a person can just pass out without and if any proper medical intervention is not administered, this person can go further and die. As we also know, our vital organs that are responsible for excretion, such as liver and the kidney, are the organs that are mostly affected when we self-medicate. This is because when a drug is taken properly, it cures, it heals the person. But when it is not, it becomes a waste, it becomes a toxin, it becomes a poison to the body, and the kidney and the liver will try its best to excrete this waste. But when it can no longer do that, it fails. So that is to say that drug abuse, drug misuse, self-medicating can result to chronic liver or chronic kidney disease. I, for example, witnessed this one when I was doing my internship in FMC Umahia. We had a baby that was admitted, a baby that was not even up to 2 years old. And after necessary tests and everything, it was realized that this baby had chronic kidney disease. And you can imagine the only wrong the mother did was going to nearby chemist to go and buy drugs for her child, not knowing that she was damaging this baby. Now, in the mother's mind, she might not have known that she was actually doing a bad thing. We as adults, we might be self-medicating and we feel that because we are still alive till now, it is not harming us. But the truth is that half of the time, a drug that doesn't just act immediately might be causing a build-up of waste, and when it will strike, it will still be very fatal. And the next thing is that some drugs are meant to be stored in a particular way. For it to be effective, there are some drugs that have been produced and it has been said that it should be stored in the freezer, it should be stored in a dry place. But most times, the chemist man or the chemist woman does not even know these things. So when you come, they just give you and then you take it and feel like this drug is imitation or something. And the next one is that half of the times you self-medicate, your body has already grown resistance because you've abused this drug, because you're not taking it in the way it had been said to be taken. Okay, let me take for example, you might have gotten your diagnosis correctly, but this time around it might not be that same thing that is doing you, because some drugs have a lot of disease conditions they are used to treat. So, and as these conditions, medical conditions are, their diagnosis, their dosages differ. What am I trying to say? A drug might be used to cure malaria, cure cough, or this one. I'm just making an assumption. Cure cough and everything. And the dosage you need for malaria will not be the same you need for cough. So because this chemist man already feels that as far as metronidazole flagyl is concerned, anybody that comes is 500 milligrams, so he gives you, and that is where you have drug abuse, drug misuse, and toxicology of drugs. And toxicology of drugs simply means the study of the harmful effect a drug can have on the human body when it is misused. And I tell you for free, it could be very, very fatal. A lot of people that have slumped and died most times is a result of drug effects, and they don't even know. So many of the times, for example, I remember a story I saw one time online where a boy, a university undergraduate, died while having sex with his girlfriend. And during autopsy, because the girl was actually arrested by the family of the deceased because they felt she had something to do with the guy's death. And autopsy was conducted, and it was found that the boy had taken sexual enhancing drugs and combined it with another drug because he had an underlying medical condition. So he took this and took that and combined it, and the group were not meant to be together. So he had an adverse drug interaction, a negative or adverse drug interaction, which led to him having a cardiac arrest and dying immediately. So half of the times, there are groups of drugs that should not go together. There are groups of drugs that should not be mixed. And some of these chemists, men or women, do not know about this. So you come, you complain this, you complain that. So they just mix everything and give you, and this can cause serious problem. And half of the times when they even give you this drug and you feel that, oh my god, this person has cured me, or it's not all this time these people be telling us to go to the hospital, it could just be that that disease condition has gone to hide. And that is the reason why some people come to the hospital and they start expecting for a magic to be done, because their body has already grown resistance to this drugs, or that the thing, they've already waited for the disease to get to the terminal stage, and they now start expecting the doctor to perform a magic. So I tell you for free, I know things are hard in this country, but please do not joke with your head. I mean, things are already difficult. Imagine going down on a more severe ailment. Drugs are chemical substances, and they should be taken the way they've been prescribed. Even when you read some leaflets on drugs, they tell you that if symptoms persist after 3 days, visit a doctor. But then you feel that this thing is not getting better, you go back to the chemist man, he tells you, oh, it's because I forgot this one, it's because you're not taking it this way I said, and then you continue damaging your organs. Thank you so much for listening. I remain your girl, Nurse Aijay, and I will be making a part B video on this topic because I didn't get to say everything I wanted to say. Thank you so much. Bye. Stop self-medicating. Bye-bye.